Worst best tomorrow ever. The understatement. 706 KUAM FM, Agotni, Guam. Good morning. And thanks for watching and listening on our KUAM News Facebook live feed. You know, leave some comments. We're trying to get those out. And Red Fausto chimes in here. Home isolation is all wrong. If there are other family members in the house, it's likely that they can get the virus and spread it to others. Moreover, if the house has aircon, the virus loves the cold and lives longer. Also, if an infected individual kisses their pet and someone else does the same, that individual may get it too. Don't be ignorant.
Right, and they're supposed to be following the guidelines that, you're not supposed to have any contact.
Okay. How many of you guys listen to your doctor?
And they're being monitored by public health.
Right. But I think that's generally how people feel about it. They feel like, we're kind of behind the curve. We need to flatten the curve. So let's get these people in an environment where maybe there's a little more medical supervision, and so, well, that's what it is. It is what it is. Guam, I don't want to say just deal with it, but apparently that's what is happening. 7:08, it is Tuesday, March 24th, and let's get Dr. Felix Cabrera on the show. Good morning, doctor.
Hi, good morning.
Half a day.
So your presentation yesterday, I felt was very, very alarming. Can we just start with that?
Sure. With what we did is when we ran these models of, what our trajectory is here on Guam based on the limited data that we have so far. We're only so many days into this pandemic, but right away you could see that we were matching, the trajectory for most of the globe. And knowing that and understanding how that applies to our resources here in Guam, in particular, the most critical part of our resources, which is our hospitals and the critical beds that we have, that's where we needed to have a better understanding of what we were actually dealing with and when things may reach a breaking point.
So you're saying this week or next week we could see a total breakdown of our healthcare system. The governor said she hopes you're wrong. I do too.
I've never wanted to be more wrong in my life.
Right.
But how realistic is it, Doc? I mean,
yes, it's very, very, very realistic. And so, and I'm saying this not to cause panic. I'm really saying it for us to be very clear about what the true risks are. I think we need to take this very, very seriously and be able to act accordingly because we can still do a lot now. Now, in terms of for the hospital, we are, it's very tough to get resources here in Guam, as we all know. And both hospitals have always been running on limited resources. And then you add this surge, and then all of a sudden that's where the break point will come from. Now, if we can slow down the surge and if patients get sick and needing the ICU, but in a more staggered fashion, and where they trickle in more slowly as opposed to being a major surge, then we have a chance to bend but not break. And the break point is really where we will see the actual deaths start really rising very, very fast, and it's because we won't be able to keep up. So the main part here is the staff that in both hospitals that take care of these very, very sick patients. Even though we may have enough ventilators, we may not be able to get them running and have the enough staff to man them. And so the rate limiting step really is the manpower that we have, and so that's something that we have to be really have a good understanding of.
Yeah, and I felt like that was part of your presentation that, really opened my eyes, is that it's not, facilities, but we have beds. We just don't have anybody to staff them.
And that was even before
Right.
the pandemic.
Yes, exactly.
Doc, can I ask just about the testing here? The latest release says COVID-19 testing is limited to priority groups. We were hearing yesterday that there weren't any tests picked up from the different clinics. And how is this new testing of priority groups going to affect? Is it going to affect the results? Because people were asking, hey, we got a lot of negatives last night, and then we see this release and see that there's been a change in you guys' strategy, who you're testing. Can you just maybe unpack that for us?
Yeah, sure. So the thing is that the collection of samples from the clinics so far, that's still can occur, and we are still encouraging the rest of the medical community to do so, especially on patients that you think are likely to have it. And public health is collecting those tests, but they're triaging within the tests themselves, and the tests that they're going to run first are the highest priority tests, and then they're going to put the rest of those tests on in the backlog, so to speak, the lower priorities. If something changes in those patients, for example, if they get sicker later and they need to go to the hospital, then they rise up into the priority testing list.
So how many?
Right now, go ahead.
No, go ahead.
Oh, so what we're trying to do and prioritize over, especially the next few days, and again, this is also in response to where we with the data that we're seeing in our trajectory. That's why what we really need to do to sort of grease the wheels in terms of trying to maintain GMH and SNU as the COVID hospital and protecting GRMC's patients and all the other non-COVID patients that are trying to move from GMH to GRMC. In order for us to expedite that process, we need to actually know who is COVID positive and who is COVID negative in order to do so. And there are situations where we have patients who are suspected at GRMC, for example, to have COVID, and it's taking 2 to 3 days to get those tests back. And then we're caring for them. We're putting them in isolation at GRMC, but the reality is that we don't know what we're dealing with, and if that test comes back positive and they're still at GRMC, then we've lost 2 days basically of getting them over to GMH. And then in return, getting somebody else from GMH back to GRMC, because it's a constant swapping because of the limited beds.
Right. And so how many days, Doc, do you think that this priority limited testing for priority groups is going to take? And is it kind of like we're going to run through everybody at the hospital, ER patients, all the staff, just to kind of get a litmus test of where we are at, right?
Yeah, we would really, and I think what we have to understand is that the recommendations for testing is going to come in different phases. And I'll be honest, it seems like every hour we have to keep pivoting in a certain way, and it seems like every day we're making big changes in what we need to do in terms of prioritizing. But right now, again, because of what we're trying to do to take care of the sickest, that's how we're prioritizing the testing. Now, again, we're also understanding that this is going to be a battle that could go on for months. And with that, and with an influx of more testing capability within that time frame, we will be able to expand the testing more, to test particularly the healthcare workers who are exposed, and making sure that they're okay, and that so that we can also limit the exposure within the hospitals itself.
I just wanted clarification because you were mentioning GRMC. So if people are feeling sick and they have flu-like symptoms, they go to the clinic, they're swabbed and waiting test results. So they go to GRMC as PUIs and surveillance cases, and then when the test results come back, and if they are positive for COVID, they're sent to GMH.
Yeah. So basically, not just anyone that goes to see their doctor in the clinic or gets seen with flu-like symptoms, they don't. If they are only sent to the hospital if the doctor feels that they actually need hospital level care, and so otherwise, if they seem well enough to go home, they're given very strict orders to home isolate, and they are swabbed, and then that's sent for testing. But they're supposed to keep very close tabs, and public health does this as well. Anytime somebody's swabbed, public health is notified and informed of that person, and so there can be a tracker on them. And if they get worse or if their symptoms change, then the recommendation may be for them to now go to seek care at the hospital. But so just to be clear, not everyone who gets swabbed and gets tested is automatically told to report to one of the hospitals.
Right. Doc, so you mentioned there's going to be a backlog of, let's say I'm feeling sick, I go to American Medical Center or wherever, I get swabbed. You're saying those tests are a backlog. How much of a backlog are we talking about? How many samples are waiting to be run?
Yeah, I don't have that data in front of me, and so I'm not sure, and that changes obviously from day to day. I was at Public Health Lab on Saturday afternoon, and I was looking through their numbers, and their and what they were seeing was that they basically only had enough tests to test the high. They basically have three levels of priority: low, medium, and high, and they're starting to have to tier even the high level ones, and so I'm not sure how long that backlog is going to be, and that hopefully will shorten.
Doc, is this affecting the types of results we're getting? Because I just want to be really careful here. You gave a great presentation. You raised a lot of red flags, but then people see things like test results released late last night, and they see a lot of negatives, and maybe that thought starts to creep in, like, oh, well, we had fewer cases.
Oh, yeah, that's. I thought about that last night. And what's actually interesting is that if you look at the projections that we had in terms of comparing to the globe, we were, even with the two tests last night, we were spot on. 29 cases was predicted for yesterday, and with those two, we were at 27 because of the additional positives we got from the day before. So it's a constant, up and down. And so we cannot make the mistake of thinking that just because we had two positive yesterday that we're doing better. Because right now, actually, we're still on the exact same trajectory.
Right. So it would be irresponsible for people to say that, hey, this is a silver lining, or hey, we're looking on the up and up.
Correct. And that's why these testing is a little bit of a double-edged sword, especially this early on, is that we can, because lower positive rate for the day, which so many factors depend on that, and the limited amount, it can give this sense that things are that we can relax in the precautions, when actually it should not give you any comfort at all in terms of relaxing of precautions. And the main point of the presentation is to say that we are still not doing enough.
Right. So let me ask you this, Doc. How is this these new testing strategies, which are being done at a time we don't have enough tests? How much are they? What I'm curious about is, if we're doing priority testing, what about those patients out there who are infected, don't know it, asymptomatic, spreading it as we speak? Is that going to get out of control while we're kind of trying to see who at the hospital or the staff has COVID-19?
Yes, absolutely. And so that's, and Chris, you bring up the critical point here, is that everyone has to understand this one very important fact, is that you can start, even though you feel absolutely 100% well, and especially if you're young, you can start being contagious and spreading the virus 2 days before your first symptom, if you even get any symptoms. And so the younger people are the vectors. The virus is using younger people as the weapon, as the gun. Basically, the virus is the bullet, but the young people are the guns. That's why seeing pictures on Sunday of people gathering at Jimmy D's, young healthy people. I cringe when I saw that, because they are the ones that are the ones that's spreading the disease, so to speak. So to put this plainly and simply, what we have to do, and the most important thing we can do, especially for this next week, is to separate our younger people from our older people, from our manuncos, because that combination is the most lethal for our island right now. In many countries, about 0 to 0.1% of those younger than 30 die from the virus. But those older than 65, these countries have seen about 1 out of every 5 or 6 of them that get the virus die from it. So what we need to do right now for an extended period of time is take care of Nana and Tata, Grandma and Grandpa, but from afar. Lots of WhatsApp, FaceTime, Skype, you name it. Even if it's from from a different part of the house. But as long as they're isolated in a different room or section, do not enter the area. Bring them well-cooked food and water in a clean container. Do not hug or kiss them, because you are putting their lives at risk. It does not matter if you yourself are feeling well, because you can be contagious for 2 days even before your first symptom.
I had a question, Doc. You were talking about the breaking point for the Guam Memorial Hospital. What about the Naval Hospital Guam? Say GMH reached its breaking point. What sort of plan or communication have you had with the military in terms of civilians being able to be brought there?
So that's a tricky topic overall. because of what because obviously, as we know that Navy has their own mission in terms of readiness and defense of the country, but at the same time they do have resources. And again, personnel resources, particularly their doctors, are some of the most valuable because a lot of their doctors do moonlight within the community and at both GMH and GRMC. There's currently an order for them to not moonlight and to kind of for them to be isolated and contained for in the event that they're going to need them there at Naval Hospital. But that being said, there is communication in particular amongst the chief medical officers between the three hospitals, and we're communicating frequently. I understand that Captain Young from Naval Hospital has spoken to Dr. Mike Cruz and has offered assistance in terms of other resources like potentially ventilators on loan or things like that of that nature. As the situation seems to need it, but right now that is not the case. But that help has been offered and will be addressed if it comes to that. So it's not that they're putting themselves completely in the dark. They are not. They in fact are trying to reach out and be helpful. But in terms of opening up the gates and starting to send patients there, that is not on the current plan right now. And doing so might there's a chance that we have to always understand risk and benefits, and there may be a lot of risk involved with that as opposed to actual.
For them, benefit would be all ours.
What about, do they provide information to you guys in terms of how many tests they run and whether, their results that they get, like what you guys provide to the public?
The short answer to that is no, not at least to my knowledge. I'm not aware of what they may or may not report to public health, because that's who they would report that to anyway. So I can't comment on that.
So if they had like a confirmed case, we wouldn't know.
You'd have to check Navy Times maybe or something.
Yeah, I don't know the answer to that. What their protocols are.
Okay, but like I said, if they had a confirmed case, we wouldn't necessarily know. They don't have to report it to the local government.
Yeah, we have to also we have to really appreciate still that mission essential people at Naval Hospital are still civilians as well. There's still some of them in terms of being federal contract workers or just federal employees, and so they live in the community here as well. Mm-hmm. So it's not like their gates are completely impermeable to the rest of Guam, and that communication is still very important. And I know that like with Dr. Thane Hancock from CDC being a very good intermediary in that process, I think is important as well.
Okay, so no, they don't have to report any numbers or anything like that.
I don't know the answer to that, but so I'm not. But I hope they do.
Doc, how confident are you in the governor's new public health emergency extension? And, I know she's tightening up the mandatory social isolation orders. Do you think that that's enough? Are you of the opinion, because you had just said that this very likely will stretch into months? Is every day that we don't go into a major extreme, martial law type lockdown another day that we lose this war against COVID-19?
I am very confident in the governor's plan to extend this emergency declaration. I'm very confident with her plan, and I applaud the efforts to shut down the beaches and public parks. And if it's at the minimum to really help illustrate the seriousness of this. The reality is that, even if we went into martial law, a complete 100% martial law and everything locked down, that still necessarily wouldn't be enough, because we need the public to truly understand what happens even within the household, mm-hmm. and what is necessary within the household. So putting our resources and all that to line the streets with tanks and military trucks is not going to be the solution to this. It's making sure that...
I'll tell you, if I saw a tank outside my house, Doc, I might stay home for the day.
Yeah, but you might start hugging your grandma even.
Yeah.
Right.
And
Doc,
that's the problem.
Right. I don't know if you can talk about this, but we're getting a message here on the Facebook. Is there any information about a potential cluster in Sinania? Do we know anything about this? We haven't heard. Is there anything you can tell us?
In terms of the cluster, I don't know anything more than what's already been published and put out there. And again, it's one of those things. I know people are hungry for a lot of this information, and it makes them feel like they have some control. They know where the threats are and where to move. But the harsh reality is that, especially over these next few days, these clusters, in my opinion, they don't really matter because we have to assume that it's everywhere and that the threat is 100% around us, and that the clusters are in front of you, behind you, and to your left and to your right. And so that's the main thing. And so we focus too much on where the threats might be and where they're not, at least in the public sense. Then I think we're losing ground instead of just understanding that it's everywhere.
And Doc, do you think that it already is everywhere?
I believe it is, and I pray that I'm wrong, but the reality is that I'm very, very afraid that this is that I'm correct in saying that it absolutely is everywhere. It's completely invisible. We don't know who has it, definitely. So we must assume that everybody has it, and that we ourselves may also have it, whether or not we're having symptoms.
Dr. Cabrera, I know that you're part of the Governor's Physicians Advisory Group. Could you tell us a little bit more about the decisions behind the home isolation? Because initially we heard that 9 that were released last Friday were per CDC guidelines, and that it was only temporary. And then so on Monday, when the press conference was held, we heard that there were 20 that were on home isolation. And then we heard just a few minutes ago from Mayor Robert Hoffman that there's this plan that these home isolation patients that don't meet, that their homes are not suitable, would be moved to the PAC Star. Is this? Yeah, can you confirm any of this?
No, I can't confirm any of that. I don't have. I'm not tracking that information on a minute-to-minute basis. But who is, of course, is public health, and I got to say that their team. I've seen what their tracker process, and it's actually quite impressive, and how they can actually follow along very closely.
Well, Dr. Hoa Nguyen, he's also part of the Physicians Advisory Group, and we also spoke with him on Saturday, I think it was. Chris, you spoke with him?
Yeah, and he was very alarmed. He said that, these patients in home isolation will infect their family members.
Yeah, I'm sorry, I missed a part there. Which physician?
Dr. Nguyen. Hoa Nguyen.
Okay, yeah, and so that again just emphasizes the whole point that we are trying to. Public health is trying to do what they can based on what they know and with the methods that have been proven in other pandemics. But Dr. Nguyen's concern is correct, and it's in line with what our immediate concern is right now, especially for this next week. Again, is that there may be a potential to infect others, but public health is also trying to ensure that there's the right understanding of what the home environment is and what can be done to protect the others within the home.
So public health can make the decisions without seeking advice from the Physicians Advisory Group of the Governor?
In which
in terms of deciding, hey, we're going to home isolate, or we're not going to home isolate, or we're going to put them up at a hotel, or
yeah. So they are definitely have the liberty to make the decisions based on their actual protocol. Now the advisory council or group that's been put together is more of a way to look at some of the broader picture of where things are right now with COVID, and then also where and trying to again get ahead of things, and Wayne Gretzky, his famous quote, it's important, you go to where the puck's going to be, not where it is. And so that's what the group is trying to actually focus on and trying to get ahead of things, and so that we can address it, and do things on a much global preventative measure.
Doc, let me ask you something. In a perfect world, right, when these patients are under home isolation, they get told what to do, public health calls on them, are we leaving too much to these patients? Are we leaving, is there too much room for human error?
I think that human error is human nature, and I think that's part of that. But at the same time, again, I just want to emphasize that's why it makes it even more important that these precautions are taken by every single person who can fog a mirror here on Guam.
Mm-hmm. Are you aware of any of the test results that are confirmed positive, if any of them were from the quarantine facilities?
I don't know that information, and I don't not to my knowledge.
Okay.
But I don't know that detail to be at all, so I can't confirm it nor deny it.
Okay, Doc, how many days do you think it'll take us to kind of run through the priority group for testing, which consists of, according to the release here, hospitalized and emergency room patients with COVID-19 symptoms, people with chronic diseases and COVID-19 symptoms, healthcare workers and first responders with COVID-19 symptoms, and older people with symptoms of COVID-19?
Yeah, that's a very tough question to answer, because there's a tremendous amount of factors that go into play. Public health is right now they're doing multiple shifts to be able to run this test. The public health lab, I should say, are doing multiple shifts to be able to run as many tests as they can. And even with that, we have to understand that these tests are some of the most complicated tests that are done in any clinical lab setting, and it's called a PCR type PCR test. And because of that, there's a very stringent quality control measures that have to occur. And if any of that is slightly off, then the test results are going to be invalidated, and that we can't trust it at all, and they have to be repeated. And so that's just the nature. That's nothing to do with anybody's competence or anything like that. That this is purely just the nature of the test itself.
Right. So, Doc, that being said, let me ask you, you had said that there's a backlog of tests from these private clinics. Are those test samples being stored in a way that's going to preserve the integrity of those samples?
Oh, absolutely. There's a protocol for how to store them, including deep freezing them, and then they can be run again. I can't, don't quote me on this entirely, but from my experience, from months to even years later.
I see.
I'm wondering if there's any way you could push for, in the Joint Information Center releases, we could have like a number that says, well, these are the cases that are on backlog. You know what I mean?
I see.
So we can, we know.
Yeah.
Kind of get a gauge.
And I think that the maybe the number, at least for me, that I think is important for not just myself to be completely aware of, but also for the public, is also in particular those priority cases that are backlogged.
Mm-hmm.
I think that's the one that's really, really important.
Right, yeah. And so this is what you guys are doing. This is for the next few days. The only people who are going to be tested are people who fall into the category of priority groups.
Yep.
Okay.
But people can still go to their clinics if they're feeling bad, and they can be swabbed.
Yeah, and I highly recommend that everybody, if you're feeling just mild symptoms, that you call ahead to your clinic or to the hotline public health, and they can actually guide you and be able to help determine whether or not you should come into the clinic and be seen, or you should go straight to the hospital. Or if you should just stay home and take the precautions there, because again, coming to the clinic is exposing yourself to the public, and you're exposing the other healthcare workers as well. So we have to be extremely mindful of that, and it's not one of those things where like just that like anything else in life, even going for a test has risk itself, because every time that a healthcare worker has to test you, they use up their personal protective equipment, their protection, in order to do that test, and that is a valuable commodity right now. And so if we can preserve our PPEs, our protective equipment, as much as we can, and if doing limited testing for those that really need it can help in that process, then that's something that we have to be extremely mindful as well. So the short answer to that is that if you can, please call ahead first, and to help determine the necessity of you needing to come in, and then go from there.
What advice do you have for people that are following the order? They're staying home. What tips do you have for them to stay healthy?
Yeah, so one of the things that I was thinking about this, and during the press conference yesterday, I used my own mother as an example, and I hope I haven't talked to her since that press conference, so I hope she doesn't mind. But the key thing is that if we isolate them and we ask them to stay in a particular section of the house or even within just their room, there's risk of that as well in terms of them. We don't want them to just be laying in bed all day and then they develop complications because of that. God forbid they end up having a blood clot in their leg. But so getting up and walking and going to the bathroom and being mobile within the home is extremely important as well. But again, kind of just understanding, the boundaries that are important, and being able to disinfect within the house is extremely important. Doorknobs, light switches, and these are very, very important measures that everyone should be taking.
Doc, do you have the latest information on how long the virus can survive on surfaces? Is that something that is rapidly evolving?
Yeah, it is, and there's we have to be very careful with these studies that are put out because a lot of them are done under controlled conditions, as in they're not like actually what's necessary in the environment. It's in a lab. They aerosolize the virus and they look at how long it is on cotton versus plastic or steel counter, and then all of a sudden in those conditions it seems like it can stay alive for a long time, like days and days. So that's under those conditions that exist. But I think the consensus amongst most of the medical community is that it can stay alive for around 24 hours on surfaces. And so that's the one thing. That's something that we have to just keep that number in mind. So something that you touched yesterday could still have the virus, and if somebody else touched that same item and then didn't wash their hands and touched their eyes or their nose or their mouth, and that could be a way of transmitting the disease. So please be very mindful of that fact, and that you could get the disease from somebody who is not even in the room anymore.
Mm-hmm. Wow, Doc, I saw something on it was Facebook, maybe even Twitter. Italy, there was a couple planes of doctors from Cuba that went to Italy to kind of help out. You mentioned during your presentation, obviously the biggest key to our healthcare crisis is a staff shortage. So have we made any, contingency plans to kind of fold in any? I mean, Lord knows everyone needs their medical personnel, but is there anyone that we're thinking could maybe lend us a helping hand should things get as bad as you think they're going to get?
Yeah, absolutely, and we're very, very fortunate. And this is the things where we have to count our blessings. This is the time we definitely should count our blessings. And there's a lot of them that actually exist here on Guam right now. And the examples are, if we're talking about physicians, there are a number of physicians here on Guam that went to medical school, like in the Philippines, for example, but have not gone through the full licensing process and residency requirements to be able to have a U.S. license to practice. But they have the knowledge base. They still work in the healthcare system in other roles, and so they may be somebody that could be important, as we go through this and this process. And so that list has already been compiled, and there is consideration of giving them emergency temporary, license, I guess, of in order to practice medicine if the situation calls for that. The same thing can be for nurses as well. Those who are have not yet taken their NCLEX, but they have the training. They could potentially become helpful. But the reality is that them becoming helpful is more on the back side, because right now the front side are the critical care patients that where their lives are at risk, and you can't just take just any doctor and to take care of these the sickest people on Guam. And so we're fortunate we have a number of critical care doctors overall on the island to be helpful for this, and that includes both in the ICU and the emergency department. A lot of our internal medicine physicians on the island are also, they have the ability to take care of critical care patients and have privileges within the ICU. I'm fortunate to be one of them as well. I still have privileges at both hospitals as well. But we are very much, it's not even a question if necessary. We're going to grant emergency privileges between both hospitals if it comes to that, in terms of ensuring that there's adequate staffing on both sides to the best that we can.
All right. You going to be at the 1 o'clock press conference?
I'm being told to be, so I guess I will be.
Any heads up on what is going to be discussed, Doc?
No, I think a lot of what your questions that you had this morning in particular, I think with the testing, is my understanding is what's going to be discussed, and getting a good understanding of that. But other than that, I'm not sure what else is on the agenda.
All right. Well, thank you so much.
Yeah, definitely.
We'll see you at 1.
Thank you. God bless.
Okay.
Stay safe, stay clean.
Wash your hands.
Yes, thank you.
Okay.
Stay home.
Right. Yeah. Stay home. 7:42. Wow. What an interview. Pretty much 40 minutes of Dr. Felix Cabrera.
Lots of good information.
Very
for people.
sobering. I mean,
reality.
Anybody
Reality
who
check.
thought that because he's in the physicians advisory group, he's advising the governor that he was going to somehow sugarcoat info. Well, you have another thing coming. Very, very alarming.
Mm-hmm.
He's the chief advisor to the governor, I guess. I mean,
I don't know if he's
and
the
he's
chief.
saying
He's part
that,
of the
right.
governor's
He is.
physicians
Yeah. I mean,
advisory group. The chief
he's
is
chiefly enough
Dr.
to call
Mike
the
Cruz.
radio, right? Yeah. But I mean, saying that this is going to stretch into months, and